Hello, everybody. Thank you for watching this presentation. My name is Brittany Schultz. I'm the sexual rehabilitation nurse and the program coordinator for the Prostate Cancer Supportive Care Program in Prince George. Today, we are going to discuss managing the impact of prostate cancer treatments on sexual function and intimacy. I want to start by applauding each of you for watching this presentation. I know that this can be a time of many changes and challenges, which may be emotional, physical, or psychosexual. I hope to share some knowledge with you today that will help to empower you in your prostate cancer journey. A quick thank you to our funders. We are a grant and donation funded program, so we are thankful for the continued support of our donors. Our program was initiated in Vancouver with funding from the Specialist Services Committee. Since then, we are very thankful to have received a grant from the Ministry of Health to expand provincially within BC cancer sites. We are really excited to have the ministry on board and in seeing the value of education programs such as ours inside the healthcare system. Today, we will begin by discussing our program and what services we can offer. Then we will introduce the concepts of sexuality and intimacy and what normal sexual functioning is. We will discuss the impact prostate cancer treatment can have on your sexual function, as well as some management approaches. We will be reviewing a lot of information in this presentation, and the degree of relevancy will depend on what stage you are at in your prostate cancer journey. The PCSC program is a supportive care program for patients and their partners. We offer education sessions as well as clinical support appointments. You get to choose which modules interest you. We also conduct research studies within our program, and we collaborate with partners across North America. Here are the different education modules that we offer. They are all offered either in person or through live online programs. The education sessions are offered every month, and most of them have a clinic. If you're interested in learning more about our one-on-one appointments or the education sessions, please get in contact with your local program coordinator. Our contact information will be on the last page of this presentation, and we will make sure to get you signed up for the next time that is offered. So in the sexual rehabilitation program and clinic, our goal is to provide education, supportive care, as well as medical and surgical therapy to enhance your sexual functioning, your intimacy, and overall your quality of life. Here is a look at the sexual rehabilitation services available across the province from the Prostate Cancer Supportive Care Program. The program is currently implemented across 4 sites in Victoria, Vancouver, Kelowna, and Prince George. Our lead physician is Dr. Ryan Flanagan in Vancouver, and we currently have sexual health clinicians in Victoria, Vancouver, and Prince George. And also shown is our administrative leads for the program, Dr. Hagano, Manita Sundar, and Jenna Bentley. There are a couple different ways of accessing care. First, the in-person clinic that the PCSC program offers. So our clinic offers one-on-one clinic appointments with the sexual health clinician for patients and their partners to discuss the impacts of treatment on sexual function and intimacy. A lot of the information in this presentation is a very brief introduction to various treatments and strategies for coping with sexual dysfunction. So I highly recommend signing up for the clinic, as then we can spend more time on what you want to learn and develop a more personalized plan of care. Appointments are available as virtual health appointments if you have access to a device with a webcam, as telephone appointments, and some clinics are offering in-person as well. And then the option of the online Share clinic. So this is an online course where you can access education modules and have the opportunity to engage with a health coach. This is a really good option if you prefer to learn at your own pace, if you live farther away from one of our clinics, if you travel often or you would like additional information and resources in addition to your one-on-one clinic interactions with the PCSC program. Just know that you do need a login code to access this program, and you can contact your local program coordinator or sexual health nurse if this is something you may be interested in. We recommend combining our sexual rehabilitation clinic with the online Sherry Clinic, as both clinics will complement the efforts, education, and resources needed to help you with your sexual adaptation process. This is a sample of the Sherry Clinic. It is very intuitive to use. On the left-hand side is the patient dashboard, where you can access various resources, such as a care plan, a wellness plan. You can make a schedule with a to-do list and keep track of symptoms you may be having. And you are able to include a circle of care if you have a partner. And this is an example of a patient, George, speaking with their health coach using instant messaging. You can also book phone or virtual appointments with the health coach. So you've probably heard that treatment for prostate cancer can affect your erectile functioning. This can impact your sexual functioning, how you feel as a sexual person, and intimacy with a partner. Today, we will start with creating some perspective with information about intimacy and sexual functioning. A lot of this information will seem specific to partnered relationships, but most can still pertain to you if you are single, or also if you are interested in finding a new partner. Let's take a closer look into sexuality, as there are many components. Though sex is something that we do, and sexuality is the essence of who we are as unique individuals. It is how we express ourselves, what brings us joy and pleasure. It encompasses all the feelings, attitudes, and behaviors that contribute to a person's sense of self. This is the wheel of sexuality, and it shows the diversity of our sexuality, including elements of biology, psychology, and social influences. It is important to be aware of these components and how they may be impacted by your prostate cancer experience. And having that awareness will help you as you go through the sexual adaptation process, which I will talk more about later in the presentation. So intimacy is an umbrella term for that affectionate or loving personal relationship with another person. It is that closeness that you feel with someone. And there are multiple dimensions that make up intimacy. And it's really powerful to share intimacy with another person. Let's look at those dimensions. So first, intellectual intimacy is a rich meeting of the minds. It's your interests, thoughts, ideas, and having connection on values. Experiential intimacy is the closeness and activities, the things you do together that you enjoy. Sexual intimacy are practices of a sexual relationship with a partner. And emotional intimacy is how you support each other and how you're vulnerable together, having those feelings of closeness and trust. And for some, there may be spiritual intimacy as well. There are many ways of being intimate with one's partner, and it's important to communicate what dimensions of intimacy are important to you and how to maintain that closeness throughout your relationship. You'll notice that each bubble in the picture is equally balanced and all the same size. But in reality, you might find that some of these bubbles are different sizes, depending on what is important or relevant in your life. For example, the emotional bubble may be more important in your relationship than the sexual bubble, and that is okay. You get to decide how to share intimacy with someone. Now let's explore what is normal sexual function. So we'll take a look at the sexual response cycle. Most people start with having sexual desire and arousal, where you become sexually excited. Then an erection may occur, though it is not necessarily needed. After the erection, you may arrive at orgasm or climax, which is usually coupled with ejaculation, the release of fluid. Then you enter the resolution and refractory phase, where the penis becomes flaccid or softened, and another orgasm or erection is not possible for a period of time. There are many factors that can affect each of these processes, and each process can directly impact another, which is demonstrated in the circular diagram on the left. So for the first stage, many factors can affect your sexual desire and arousal. Most of these are common sense, such as if we're feeling stressed or anxious, haven't been sleeping well, or having a lot of pain or have erectile dysfunction. That can all impact how in the mood we're feeling. Also, some people don't realize that there are certain medications that can impact your sexual arousal, such as hormone treatments or antidepressants. And if that's something that's of concern to you, you can talk to your doctor because there might be alternative medications. The next process in the sexual response cycle, the erection, there are many factors that can affect them as well, as erections are a complex process. So medications like antidepressants and blood pressure medications can affect the function of the penis. There are medical conditions such as diabetes or high blood pressure, as well as lifestyle factors like smoking, obesity, or excessive alcohol or drug use that can all affect the health of your blood vessels. And blood vessels are necessary for healthy erections. Surgical procedures and radiation treatment, so having your prostate removed surgically or radiation therapy in the pelvic area can affect the nerves which cause erections. And also psychological or emotional issues can impact erections, including having stress, anxiety, and depression. And then moving on to orgasm and ejaculation. First, I want to point out that orgasm and ejaculation are different processes. So orgasm is the pleasurable sensation typically achieved after sexual stimulation. And ejaculation involves producing semen beyond the penis. So the prostate creates 90% of the fluid that you normally see. So when the prostate is removed or damaged, then that fluid will be impacted. So you can still have intercourse and orgasm, yet this might be a change for you. Research shows that the amount of arousal you have before orgasm can impact the intensity. So the more sexual stimulation and arousal that you have, the more intense orgasm. Erectile dysfunction can also impact your ability to orgasm. This is mainly psychological, as many individuals are not aware that you can still have orgasm with a soft penis. Many prostate cancer treatments can affect the intensity of orgasm, can also cause orgasmic pain, and lead to dry ejaculations, as well as how often you are orgasmic has an impact. And then medications, as mentioned before, can have an impact. And finally, lower levels of testosterone can decrease the intensity of your orgasm. And if you are on hormone treatment, then you may have a lower testosterone level, but there's also a natural age-related decline in testosterone level. And finally, the resolution and refractory period, which again is that natural phase of recovery when another erection or orgasm is not possible. That phase of recovery does increase with age. Other factors that can impact this time of recovery are things like if you're feeling fatigued, stressed, or anxious, and if you're using excessive alcohol, as well as some medications, as mentioned in previous slides. I want to take some time to talk about how erections work. Erections occur from thinking sexual thoughts, from sexual touch, or in our sleep. All forms of erections require a signal to be transmitted from the spinal cord to the penis through an important nerve called the cavernosal nerve. The nerve sends signals to your blood vessels, telling them to relax and let more blood into the penis. You can see in this cross-section picture of the penis that there are two structures that look like tubes, which are the erectile bodies. The diagram on the left is a flaccid or soft penis, and the one on the right is an erect penis. Inside the erectile bodies, there are tiny spaces. They look kind of like a sponge or Swiss cheese. And when the smooth muscle in these tiny cavities relaxes, the cavities expand, which allows blood to flow in, forming an erection. Another important note is that normally men will have what we call nocturnal erections, which involves having 3 to 6 spontaneous erections per night. Most are unaware of this unless you wake up and notice the firm penis. This is the penis's natural way of working out. It's providing oxygen-rich blood to the tissue for it to stay healthy. If you have erectile dysfunction, your penis may not be working out at night on its own, so you may need to engage in penile rehabilitation to keep the blood flowing. We'll talk more about how to keep your penis healthy later on in this presentation. So prostate cancer treatment can cause erectile dysfunction. Erectile dysfunction can occur from 3 processes. The nerves that help cause erections can become injured. The muscle in your penis can become fibrotic or less healthy over time. And the arteries which bring blood into the penis can become damaged, which stops the penis from receiving adequate blood flow. We'll take a look at these in more detail in the next few slides. The nerves that are important for creating erections are highlighted here in yellow. They are called the cavernosal nerves. They start in the spinal cord and run down the back of the bladder, wrapping around the prostate and into the penis. They are very close to the prostate, essentially a cell layer away, which is why any treatment for prostate cancer can cause damage to these nerves. Let's take a closer look at the various prostate cancer treatments and how they can affect those nerves. So for surgery or a radical prostatectomy, the primary goal of the surgeon is to remove the cancer. You can see in this image, the nerves are highlighted in the picture on the top left. This shows the close proximity to the prostate. If the surgeon is able to, they will try to spare the cavernous nerves, and that is called a nerve-sparing surgery. But it's not always possible to spare the nerves, depending on where the cancer is in your body. You can also have issues with erectile dysfunction, even if the nerves are spared. This is because the nerves are very sensitive and can enter into a shock phase that's called neuropraxia. In that shock phase, the nerves aren't working anymore, and it can take up to 2 to 4 years for the nerves to heal and come out of that shock phase. Radiation therapy. There is external beam radiation therapy, and this is shown in the top right. So the area, the red area in the top right picture is the prostate, which receives the highest dose of radiation. The green area includes the area where the nerves are that still get a smaller amount of radiation at about 40% of the dose. And other areas in the pelvis, shown in blue, will be affected, including the bladder and rectum, which is why many patients have bladder or bowel side effects when receiving radiation. And finally, brachytherapy involves the placement of radioactive seeds directly into the prostate, and that's used to destroy cancer cells. So the region surrounding the prostate receives some of this radiation as well, and that includes the area where the nerves are. Prostate cancer treatment can cause the muscle within the penis to become more fibrous and less healthy over time. Around the penile muscle, there is a sheath of tissue called the tunica. You can think of it like saran wrap around the penis. And normally, when the penis fills with blood, the tunica tightens and closes off the blood vessels. This keeps the blood in the penis to maintain an erection. With the tissue becoming more fibrotic, then it won't have that ability to expand and tighten, which will prevent the blood from staying in the penis. And this is what we call venous leak. Imagine you're going for a bike ride and need to fill air into your bicycle tire. If the valve isn't sealed properly, no matter how much air you pump into the tire, the air will not stay in and the tire will be soft. It's the same thing with venous leak. You may have good blood flow into the penis, yet if you're unable to seal off the veins, then the blood will return into the body, causing a soft penis. To form a rigid erection, you also need to have that good blood flow going into your penis. Prostate cancer treatment can cause the blood vessels inside the penis to become damaged or become narrower. This can limit the blood flow going into the penis, causing erectile dysfunction. If this occurs, you may require treatment to ensure your penis gets enough blood to stay healthy. Compromised arterial inflow may be reversible depending on the treatment and damage. Here we have a graph showing the timing of erectile dysfunction when comparing surgery or prostatectomy, as shown in red, radiation therapy, as shown in yellow, and active monitoring, as seen in blue. For active surveillance, which is where your doctor may decide to actively monitor the prostate cancer with no treatment, you'll notice there is a decline in functioning due to aging. So regardless if you have treatment or not, there is natural progression of erectile dysfunction. For surgery, there is an immediate decline in function within the first 6 months, then a slow improvement over 2 to 4 years. And for radiation therapy, there's also some immediate decline in function within the first 6 months due to inflammation. This can improve within 6 to 12 months post-treatment, and then follows a natural rate of decline. At 36 months, the rate of decline in erectile function is very similar between no treatment and radiation therapy. You can see that the two lines are very close together at these 2 points. At 72 months, or 6 years, the percentage of men with erectile dysfunction is almost the same as if having no treatment, and this is around 30%. Next, this is the timing of erectile dysfunction with brachytherapy. So the top graph shows men with normal erectile functioning before starting treatment, and the bottom graph shows men with some erectile dysfunction before starting treatment. Within each graph, you will see there are 2 lines for each time point. The line on the left is men that are on ADT, and the line on the right is men that are not on ADT. So let's start by looking at men who received brachytherapy with ADT. We've added in a blue line to show the general trend. The most significant decrease in erectile function is within 1.5 months after treatment. Then for both groups, there is some improvement. And looking at men who only received brachytherapy, there is also some decline in function within the first 1.5 months, and then a continuous decline, eventually following a natural rate of decline. This is shown with the red line. In general, the most important considerations are your erectile functioning and age prior to starting treatment. If you have full erectile function before starting treatment, then the more likely you will have better functioning afterwards. Let's look at each treatment and how it can impact sexual function. So again, some patients will start with something called active surveillance, where the doctor will decide to monitor the cancer without treatment. This is typically for men with intermediate or low risk prostate cancer. There are not usually too many side effects as there is no treatment, so it would usually be from anxiety or other psychological factors. Sex drive may decrease due to stress or anxiety. Erectile dysfunction may occur and potential changes to orgasm due to stress or anxiety, and no changes to ejaculation, penile shortening, urinary issues, bowel issues, or other changes. For prostatectomy, The onset of sexual function changes is immediate, as the nerves will be affected either by removing them or from shock. Sex drive is not directly affected unless you are stressed. Erectile dysfunction can be immediate. Most men experience it at least for 6 months, and repair can take up to 2 to 4 years. Orgasm, 40% of men find orgasm is the same post-surgery, and 40% say it's different. And then 20% say that it's better. Approximately 15% will have pain with orgasm that's usually temporary, and it's thought to be due to a muscle spasm. And this usually decreases over the first year. With ejaculation, there will be no ejaculate, as the prostate and the plumbing will be removed in surgery, the plumbing called the seminal vesicles. Men report different experiences with the dry orgasm. Some will describe it as a more intense orgasm, while others feel the orgasm is not as pleasurable. The Cowper's glands are not affected in surgery. Therefore, you might still notice pre-cum, or that pre-ejaculatory fluid can still be present, and that's a clear and stickier fluid. Penile shortening is something that many men report, as well as shrinkage following surgery. It's thought there are a number of factors that may contribute to this, including scar tissue formation, reconnecting of the urethra to the bladder, and damage or interruption to the blood supply of the nerves. The complete reasons for penile shortening and shrinkage are not yet fully understood, and usually the length is restored by 1.5 to 2 years. For urinary side effects, there may be a thinner fluid present when orgasm after surgery, and this is called climacturia, or the release of urine at climax or orgasm. Just note that urine is considered to be sterile, so it is clean. And as long as you don't have an infection, it won't be harmful to your partner if urine gets in or on them. And climacturia usually improves in the first 6 months after treatment. If you don't have any improvement, or if you have any questions or concerns, you can come to our Module 5 presentation called Pelvic Floor Physiotherapy for Bladder Concerns. And typically there are no concerns with bowel issues or other. Now looking at radiation therapy, which again includes external beam radiation therapy and brachytherapy. The side effects are similar, so I'll discuss them together. So the onset can be immediate, remembering the graphs that I showed earlier. Sex drive is not usually decreased unless you are on ADT. With erectile dysfunction, there is an immediate decline in the first 1 to 6 months, then some improvement in the next 6 to 12 months, and then it follows the natural age-related decline. With orgasm, you might have some short-term pain with orgasm or difficulty reaching orgasm. And ejaculation sometimes is decreased or dry, or if you've had brachytherapy, it may be blood-tinged initially. Penile shortening is possible, yet it's more rare. And because the bladder is in the same field as the radiation, it may become irritated and cause issues such as increased frequency, difficulty urinating, pain with urination, or blood in the urine. And because the prostate and the rectum are very close, bowel side effects like diarrhea or inflammation of the rectum and anus can occur. And some other changes include radiation skin irritation or burns where the radiation has traveled through your skin, or pain at if you've had brachytherapy, pain at the site of seed insertion. And lastly, ADT or hormone treatment, which is a treatment that reduces testosterone, which is the fuel source for the prostate cancer to grow. Testosterone is very involved in sexual function and can impact a lot of different areas. The onset is typically immediately. Sex drive is decreased in most men. Erectile dysfunction usually also occurs immediately. There can be decreased intensity of orgasm and decreased volume of ejaculate. Penile shortening and testicular shrinkage is very common with hormone treatment. And there's not usually any concerns in the areas of urinary and bowel side effects. And there are some other common changes, such as weight gain, breast swelling, fatigue, and hot flashes. If you are on ADT or considering hormonal treatment, I highly recommend you watch our education session on androgen deprivation therapy, where we spend about an hour going over all the possible side effects and how to manage them. In review, what are the most important factors that impact erectile function after treatment? So if you have good pre-treatment erectile function, then the better chance you will have good erectile function post-treatment. And you can start stimulating that blood flow and promoting healthy tissue prior to treatment. Age is an important factor, as erectile dysfunction is a normal aging process, and younger men may have slightly less of an impact or may recover quicker. Our radiation therapy today is more targeted and precise than it used to be, which suggests improved erectile dysfunction. And finally, the degree of nerve sparing in surgery will impact your function. It's really important to know that despite many challenges and barriers to overcome, that you can still have a good sex life after prostate cancer treatment. Let's explore some myths in society that we've all heard. People with health challenges have no interest in sex. So that is not true, as people still have interest in sex despite having health challenges. That male orgasms require an erection. This is a very common myth, but even with a soft penis, you can achieve orgasms. Sex is for young people. Definitely not true. Many people are sexually active until the end of life. Good sex requires orgasm. So you can still have a good sex life without orgasm, as it can still be enjoyable and pleasurable. Sex education is only for disease prevention. We commonly think of sex education as just for information about maybe STDs. Yet sex education is for many reasons and can also be for sexual dysfunction. Sex should be spontaneous with no planning and no talking. Again, not true, as sometimes sex does need to be planned. And that's especially true when you're using some of the devices that we'll talk more about later. Sex means sexual intercourse. There are many ways to define sex. It can mean oral sex, touching, self-stimulation. There are many different options. And lastly, men should initiate sexual activities. Not true again. Everyone can initiate sexual activities. It doesn't just need to be the man. So when you look at your own values and beliefs, it's important to recognize if they are influenced by these myths or any others. And if they are, and when you start to see changes with sexual health or function, that's when we can run into problems, as it can provide a barrier to exploring new opportunities. So how do we move forward or go about managing this? Let's take a look at some approaches for managing sexual consequences of prostate cancer treatment. So you can schedule a one-on-one appointment with a sexual rehabilitation nurse, and if you have a partner, we highly encourage them to attend. And we'll talk more about communication, sexual adaptation, and the therapies for improving erectile function in the next few slides. The most important way to improve your connection and sexual functioning is through communication. By maintaining an open dialogue, you can ensure that each of you are satisfied with your sexual relationship together and that you're on the same page. You may ask, why should we talk more? It is proven to be the best way to enhance your sexual satisfaction after having treatment. Sharing your thoughts and feelings can help you both to process any changes. We like to say that prostate cancer is a couple's disease, as prostate cancer treatment can affect the partner just as much as the person with cancer. This is why it's important to ask your partner how they are feeling. We often think that we know someone so well that we can read their mind, yet this isn't true and research has proven this. It's important not to assume your partner feels a certain way. So how do we communicate better? You can think about what is important to you and your partner and discuss both of your thoughts and pay attention to your partner's responses and acknowledge their feelings. If you don't feel comfortable talking about it out loud, some people find that writing a letter or some notes is helpful. And you can always see a counselor or sex therapist that's trained to open up the conversation and make it easier to talk about. Here is the intimacy diagram we saw earlier in the presentation, just to remind you that there are many ways to connect with your partner. It may feel natural to put all the focus on the sexual type of intimacy, especially if erections are not working post-treatment. Yet it's important to look at all the dimensions of intimacy. There are many ways to enjoy being close with your partner. Now, most of this has been focused on partnered relationships, but being sexually active and feeling attractive is just as important if you are single. And the same treatments and resources are available for single men, whether you want to be able to masturbate, have sex, or start a new relationship. All of this information applies, and we highly encourage single men to come to our clinic. If you are starting a new relationship, we know it can be challenging to share your cancer experience. We find that being honest and keeping it simple is important. Prostate cancer treatment can cause changes in your sexual life, and it requires adaptation. So this process can be complex, and it warrants the need to apply these principles of acceptance, flexibility, patience, and persistence. It can also include grieving loss and moving forward with new ways of being sexual, as well as redefining one's sexual self-view. And this may include sexual and penile rehabilitation. We'll talk more about sexual and penile rehabilitation in the coming slides. Our one-on-one clinic appointments focus on helping you with sexual and penile rehabilitation. Sexual rehabilitation begins with the awareness of the potential for sexual difficulties following any disruption in health. When you start sexual rehabilitation, you can focus on gaining knowledge about sexuality and how to cope with the difficulties, communicating with your partner, looking at how to manage feelings of sexual inadequacy and masculinity, looking at understanding how societal myths may affect your sexuality, and possibly adjusting your values and beliefs to enhance your sexuality, and then discovering new ways of supporting your sexual health and goals. And penile rehabilitation focuses on the health of the erectile tissue. It is the idea that if you can continue to stimulate the muscle with or without a partner, that later erectile function can be improved. Remember when we discussed those nocturnal erections, the penis's natural way of working out? When you don't have that natural workout, you may need to do this yourself to keep the penis healthy, if this is important to you. Tissue can become fibrotic over time if it's not used, just like any muscle in the body. So if we don't use our muscles, our body can become deconditioned. And it's the same with the penis. It needs to be working out to stay healthy. There are various ways of engaging in penile rehabilitation, including penile massage, oral medications, injections, and vacuum therapy. Now, your treatment and recovery will determine when you can start these interventions. So talk to your doctor about when it is safe to do so. And we recommend doing penile rehabilitation for a minimum of 2 to 3 times per week, and continuing to do this until spontaneous erections come back. And remembering that this can take time. For surgery, for example, it can be several years before the cavernosal nerves will heal. Let's talk about some of the erectile dysfunction treatments, as I know many of you are interested in this. The oral therapies or pills inhibit the enzyme called phosphodiesterase 5 or PDE5. This enzyme is present in cells lining the smooth muscle tissue in the penis. When we inhibit this enzyme, it causes the smooth muscle to relax more and allows blood into the penis to cause an erection. The first thing men usually try are the oral therapies, as they are considered one of the easier and least invasive therapies. These pills all work similarly, as they are the same type of drug. However, some men respond better to one than another, or you may have side effects with one and not another. So it's good to try them all at different times, of course, to see which one is the most effective for you. One thing to consider is if you have any heart conditions, such as if you use nitro spray, or you have very low blood pressure, then this may not be appropriate for you, as these medications can lower your blood pressure, and if you're already taking something that lowers your blood pressure, it may cause problems. So always talk to a doctor before taking these medications. These pills rely on nerve function as well as testosterone. So if your nerves were damaged or removed, then the pills might not be effective. And if you're on ADT, they may not be effective as your testosterone will be lower. That being said, men on ADT or who have had no nerves spared in their surgery have still responded to the pills, so it doesn't hurt to try. But being informed is important. You can see the different versions of the pills on the slide. There are short-acting and long-acting medications. Short-acting include Viagra, Levitra, and Staxin, and they're only in the body for 4 to 8 hours. Long-acting is Cialis, and it can stay in the body for up to 24 to 36 hours. Another thing to note is that you may need to try these pills 6 to 8 times before your body gets it and it's effective. It's really important to know also that you have to have good sexual thoughts and stimulation after taking the pills. So you can't just take a pill and be reading the newspaper waiting for something to happen. So after about 30 minutes of taking a short-acting medication or 2 hours after the long-acting medication is when you need to have that sexual arousal and stimulation. There are some potential common side effects, including facial flushing, nasal congestion, blurry vision with Viagra, headache, muscle cramping with Cialis, hearing changes, and indigestion. And important to note that Viagra and Levitra are significantly affected by fatty foods and alcohol. So you want to take these on an empty stomach or wait at least 2 hours after completing a meal. And you always want to ask your urologist or family doctor for samples, as these pills can be quite expensive. Some extended benefits will partially cover these medications. Next is an option called MUSE, which stands for Medicated Urethral System for Erections. This is a tiny pellet or suppository about the size of a grain of rice or a gel, which is administered into the urethra using an applicator. The urethra is the tube where a catheter would go or where the urine would exit your body. It looks as though it might be uncomfortable, but men report it is actually quite well tolerated. It's not commonly used in Canada because it's quite expensive if it's not covered by your insurance, and it only works about 40% of the time. That being said, men in the UK love using MUSE as it is covered in their healthcare system. This option can give good quality erections within about 10 to 15 minutes. It isn't appropriate for all patients. If you have urinary incontinence or leakage, then the medication might not be absorbed properly. Some side effects include the medication can cause irritation to your urethra and your partner's vagina or rectum if you are having penetrative sexual activity. Now looking at penile injections. So these are one of the most effective erectile dysfunction treatments, about 90% effective, and one of the most affordable therapies. A lot of men will ask, I've tried the pill several times and haven't had a response. Will the injections even work for me? And the injections typically do work better than the pills because they are not reliant on nerve function or testosterone to be effective. It's a very local response where you inject a small amount of medication into one side of the penis, which causes that smooth muscle in the penis to relax, causing blood to flow in and form an erection. You only need to inject once on one side to form a full erection. And it produces a good quality, long-lasting erection, ideally 30 to 60 minutes or however long is pleasurable for you. This creates a more natural-looking erection than other therapies, and the erection will look like a natural engorged erection. So what's the biggest problem? It's a mental image. So a lot of men are hesitant to try penile injections as they're afraid it will be painful, and many people do not like needles. I will say it's a very small needle. Most men don't even feel it. And the most challenging part of the injections is psychological and being comfortable with the technique. A sexual health clinician or urologist will do a one-on-one teaching with yourself and your partner about how the medication works, how to draw up the medication, different holding techniques, and how to inject. There are some possible risks. So priapism is where you get an erection that you can't get rid of, and that can occur in less than 1% of men. Another thing that can happen is scarring of the penile tissue. These are both very small risk, and we teach methods to minimize it, but it's good to be informed to prevent the risk for this. And next, looking at the vacuum erection device. So the picture here shows a medical grade device. It's been tested to ensure the correct pressure is applied. You may have seen some in adult love shops and online, and some men do use these. However, we recommend using the medical grade vacuum erection device to prevent any damage to the erectile tissue and to ensure it's effective. It is 80 to 90% effective when used correctly. It can take a bit of time to get used to, which is why if you do purchase a vacuum pump, we recommend using it regularly at first to learn how it works. A lot of men really like using the vacuum pump because it's considered to be more natural, so you're not taking a medication. They also like how you can use it for two purposes. So it can be used for penile rehabilitation, which is doing those exercises to ensure the health of the penile tissue. But you can also use it for sexual activities, whether that's self-stimulation or with a partner. You can also use it with medications. Usually men will combine the pills with the vacuum pump for a better erection. So how does it work? The penis goes in the open end of the tube, and when you start to pump, a negative pressure removes all the air in the cylinder. And that negative pressure pulls blood from the veins and arteries into the penis. Some men like to use a tension band at the base of the penis, which helps keep blood in the penis. Because often what happens is men will use the vacuum pump to create an erection, yet as soon as they release the pressure, the erection won't be maintained. One thing to consider is that there are various tension band sizes, so it can take some trial and error to find the correct one. And also, you can only wear a tension band for 30 minutes at a time, so you don't want to fall asleep with it on. A couple tips when using the vacuum pump: you do need to have a good haircut in order to have good suction. So make sure you trim the pubic hair around the base of the penis. And also, you need to use lots of water-based lubricant. So you put a ring of lubricant around the cylinder that will be pressed against the body, and then around the penile base and shaft. If you do notice that it is pulling on the skin or suctioning in a testicle, you can ask your sexual health nurse about a special ring you can place on your penis to help with this. A couple considerations when using the vacuum pump is that the erection can look more of a dusky blue color, and it may be a little cool to touch. This is from drawing in blood from the veins, which normally doesn't happen with natural erections. It's not harmful at all, but it can be distressing if you're not informed. You can use a lubricant and warm the erection in your hands prior to intercourse if this is bothersome for you. When using the vacuum pump and tension band, for sexual activities, whether that's sexual stimulation or with a partner, you may notice a hinge effect. This is because the blood is only maintained until the base of the penis. It does not go deeper into the pelvis as a natural erection would. So I recommend just using a hand to guide the penis into either the vagina, anus, mouth, or a toy before engaging in any activity. And it may take some different positioning with your partner. The last resort is usually the penile implant, as it is a permanent procedure. So once you have the implant, you can't decide to go back to using pills, injections, or the vacuum erection device. The benefits of the penile implant is that it takes about 10 seconds to form a 100% rigid erection. And 90 out of 100 men say that they are satisfied with their penile implant. This is a day procedure. It's a 1 to 1.5 hour surgical procedure. It is covered by the Canadian healthcare system, so it's 100% free of charge. For the 3-piece device, which is shown in the picture, there's a pump in the scrotal sac, a fluid reservoir in the pelvis, and 2 cylinders which replace the erectile bodies in the penis. Once healed, your doctor will show you how to cycle it and create an erection. The erection will be consistent and firm, and after climax, you push a button to release. Doctors will usually wait until about 2 years post-treatment to ensure you have achieved the best possible recovery for a natural erection. One thing to consider is that a penile implant does not extend the length of the penis at all. If you pull your penis out in the non-erect state away from your body, that's about the size it would be when using the implant. The erection also won't be as natural as you would normally see because the tip of the penis does not get firm. It is mainly firm in the shaft or the body of the penis. So where do we begin and go from here? Remember that nothing is a quick fix. It does take time and practice and that patience and persistence. You can start by talking with your partner. That can help you deal with the changes. Discuss ways of enhancing intimacy, maybe without penetration, as there are many ways. And we can talk about these in a clinic appointment if you need ideas. Communicate with your partner about what you'd like to see in your sexual relationship together and what feels good for both of you. And you can request an appointment with a sexual health clinician or a counselor. Also, in order to supplement the information you have received today, if you go to our website, you can find videos which provide further information about these points. And here are some take-home points: that prostate cancer treatment may impact your sexual functioning. And our program is here to help you through these changes in every step of your journey. And here's the contact information for the program coordinators located in Vancouver, Victoria, Prince George, and Kelowna. Thank you very much for watching this presentation today. If you do have any questions, feel free to contact your local program coordinator.